you stated, Mr. Gaddis, the tremendous contributions in the community of Memorial Hospital. In addition to its charitable work, it has been a strong supporter of our public hospital, Natividad Medical Center, which has suffered and struggled in tough times and is now, I think, on a better trajectory. And both Memorial and Community Hospital of Monterey have been supporters in that regional support for the public hospital. I also want to acknowledge the initiative on the seismic retrofit, because as you stated, there are hospitals that have not kept pace with the earlier timelines. And from a public safety point of view, hospital retrofit, it goes to patient safety, it goes to staff safety, it goes to community safety, and to be a facility that can receive people injured in a seismic event. It has to be operable and functioning. So I applaud that work as well. I do think the questions raised and the media attention that's focused on them warrant this audit, and I think provide both those who have concerns and those leading the hospital the opportunity to really shed light. I have great respect for our state auditor. It's a nonpartisan office, and again, an audit is not a prosecution. It is not an indictment. It is a neutral, professional audit. And my expectation and my hope is that if there are any shortcomings, that this will provide the opportunity to rectify, as well as put a bright light on those areas of community support that Memorial Hospital provides. I do know that there are tough times. That was all kind of a statement. I did want to just pose one question to anyone on your team. I think for me, and as chair of the Health Committee, my biggest concern, and when I look at bills coming through the Health Committee, I always try to look through the lens of the patient. We have other interest groups. We have hospitals. We have doctors. We have nurses, all who have very important interests. Unions representing staff and hospital employees all have key interests protecting their particular interest. But it's often the patient who doesn't have a voice up here other than those who've been elected to represent their interest. So I know this will be covered in the audit, but I think just one question that I would ask is, when we look to patient quality and in a medical parlance, patient outcomes, maybe just a brief comment, are there systems that measure patient outcomes or quality of service that are part of the protocols in the hospital?
I'm sure Dr. Perot can answer that for you.
Mr. Chair, Mr. Mounting, thank you very much. Thank you very much for allowing me to answer your question. Salinas Valley Memorial Hospital has been very proud of their quality performance in the past years. It's the result of excellent employees, physicians, and the entire community that make up the system. We participate in all the public reportable data. We are the only hospital in Monterey County that actually publishes their public data online and is available for anyone to see it. I happen to be chair of the California Hospital Association Quality Committee. As a member of that committee, I also serve as a member of the board of directors of the California Hospital Association Reporting Task Force, otherwise known as CHART. Until recently, Salinas Valley Memorial has been the only hospital in Monterey County that has voluntarily participated in that quality measurement metric system that compares ourselves to about 280 some hospitals that are also voluntarily reporting their data. We provide that data online also for you to report. We are carefully monitoring everything for trends, just like anyone else is doing in healthcare. We're very cognizant of the fact that there is always possibility of changes in quality, but we really always want to address any changes in quality or patient safety. We have invested heavily in a lot of patient safety initiatives, especially around medication management, of which we're very proud and really on the cutting edge in Monterey County. And we'll continue to do so because we feel that that is an important mission and role of our entity and our organization. So, yes, we do have that, and I hope that the audit would look at that quality data because we do provide it, and we're very happy and very proud of what we provide.
Thank you. And Mr. Chair, just a final comment. Again, I appreciate your sharing that. I know that that would be included in some of the materials that would be evaluated in the audit. And again, I hope this will be an opportunity for both those that have expressed concerns and those who, well, both sides have expressed concerns. And I think the audit is our best vehicle to really shed light. And if there's positive recommendations, the way our audits come back, there are very objective findings, and then they also include recommendations. And I would hope that in that area of recommendations that might come back, it'll just make the services that much stronger. Just my final comment, I think a lot of the spotlight has focused on the executive compensation and particularly the retirement package of the CEO. I know of his many years working to build Memorial Hospital. I think that is not in question. I do think in general, and in this moment, it's Memorial that got the spotlight. Some of these, we are under scrutiny for pension plans in the state of California. Under both Governor Schwarzenegger and now Governor Brown, we've renegotiated the pension packages of 21 state employee unions. In every one of those negotiations, we've raised retirement age and we've increased the contribution to be paid by the employees and reduced the amount that's being contributed by the taxpayers. That's a trend that Californian voters say they want. And yet the headlines that suggest that these pensions are out of control comes when executives who bring training and skill and competency receive pension packages that are just so out of line with what most working people get. And that's where I think the perfect storm, as Mr. Gaddis described, when you have 200 staff level people having to face layoff, and simultaneous you have an executive officer, and I'm not talking about merit, I'm just talking about sheer amount in a tough economy, receiving a multi-million-dollar retirement package. It is not surprising to me that it provokes the concern that at least in part motivated this. And again, Memorial is not alone in this. I know that when we look at comparative retirement packages in the industry, this may indeed be in line or at a median level or below average or whatever. It's just, I think, for workforce that work very hard, often overtime hours, executives bring knowledge and skill. Workforce also put in very long hours and often in life-saving capacities. So, again, I think just a commentary kind of on the context of this. I appreciate your being here in Sacramento today. I appreciate my colleague, Mr. Aleo's, creating this avenue for getting some answers. Thank you, Mr. Chair.
Thank you, Mr. Martin. I think Senator LaMalfa has a question.
Yes, I do. Thank you, Mr. Chairman. I totally respect the effort by Assemblyman Alejo and his desire to get answers to these questions, and you're right to have them. So I'm with you on that. With regard to the scope of the audit here, I guess that's where I have a lot of difficulties. That we'll talk about the bank portion for a moment here. Now, you want good board members as part of your hospital local boards there, and so frequently you draw from a lot of different types of folks in the community, and members of bank boards are very active members of the community. So I'm sure we wouldn't question that they make a valid addition to a board like that. There happens to be a relationship with that bank and the hospital. I would imagine that could be a concern that would be allayed pretty quickly in the process if protocols are being followed. And then we get to the pension, the retirement for Mr. Downing himself. Now, I agree that the size of that is not passing the smell test for the people in the general public when we just look at that and see the size of this with everything else going on with pensions for employees, for management.
this is a fellow that's going to draw more than the governor of California makes in salary. And I would imagine the governor of California's weight is a little bit bigger than this. So there's a perception that it's bad. So I think what we're really looking at here is the audit the appropriate place to contemplate the size of that pension? Yes, if it's being done appropriately, but I think the bigger picture is the pension size in general. And is the audit the appropriate vehicle for that? Or maybe another look at the way the policy that and other hospitals and other entities should be doing it. So what I come down to is the size of the audit. Again, with your right and desire to seek answers to questions, which I support, I think the size of the audit is too large in the scope of the number of hours and the number of dollars that would be expended by the auditor, meaning, the state, as well as what it might cost the hospital itself in order to address this audit. So, again, hospitals we support, they're there to provide a service to patients and people in need. So I wouldn't want to see them burdened so much, but more so that the work of the auditor in an area that probably could be done in my, seat of the pants view of it here is that maybe 1/5 of the size of this audit could answer the questions we're concerned about here. In the different points. The 6th point, identify their revenues, expenditures, staffing levels. That probably really isn't a policy area we should be looking at in the audit. Other areas, that's fine. But I would be supportive of an audit and your desire and right to ask for that if it was much smaller. So I would propose maybe a 500-hour, $50,000 audit would be more appropriate for what I would view as fairly simple answers once they're dug down on by this auditor from a state level and not so much internal or local. I would think we could accomplish that. So I would support it at that level, but I have a lot more difficulty with these resources and this size and scope of what you're seeking.
Well, first of all, the amount of hours and...
Mr. Alejo, give me a second. Do you want to have him respond to that? Or was that just one of our comment? I'm just trying to move
It's a comment, but I'd sure like to have your response to that, Assemblyman Alejo, if you like. And,
Well, this is one of the most, it's a very narrowed audit already. It's one of the least expensive being presented at all the audits here today. And the people of the Salinas Valley and taxpayers throughout California and the legislature deserve to have questions to all these valid questions. So many concerns have been raised by numerous folks out of the community, and there's also been an outpouring of public support. You can't imagine the number of emails, the phone calls, residents coming out saying, "I thank you," and the other legislators for looking into this and requesting the audit. They themselves said they welcome the audit in its current scope. So, like I said, if there's nothing to hide, they will surely be supportive of this audit as it is presented here today.
Thank you. Senator Anderson.
I guess I have a different take than my previous colleague in seatmate. I think that they've been somewhat transparent coming here addressing some of the issues. I'd like to give them an opportunity to answer your questions without spending $250,000. And if you'd be willing to bring this back in 120 days, if you're unsatisfied, then I could be happy to support the audit. But right now, usually I think in terms of the audit, when you ask for it, when you've presented questions and they stonewall you or they don't answer to your satisfaction. I'm not sensing that in this room today. I thought that while they're cursory responses, they were responses almost like an olive branch asking for those questions to be asked. And in these tight times, I'd rather not spend the $250,000 if you can get your answers by simply requesting it through a letter. And if we could get a commitment today from them to answer this, if you're not satisfied, then I think that we actually should move forward with this audit. But, I've worked with CalPERS, I've worked with CalSTRS, and they have not been forthcoming. In fact, they've been less than forthcoming, and we are pursuing them. When you're talking in terms of executive compensation, certainly the UCs what we've seen, what they've been doing, what they've been paying their presidents, the outlandish salaries that they've received. When you look at CalPERS or Caltrans or CalSTRS, all of these have had outlandish, lavish benefits and salaries for top executives. And I think that what you're focusing in on is an important and terrific issue, and I want to be supportive of it. I'm just concerned about the process. So if we push ahead today, I won't be supporting the audit because I'd like to see the process give them an opportunity to be transparent. If we do hold off, you can guarantee that I will give you my vote in 120 days. But I just want to be clear that the questions that you're asking, I think are reasonable. I just think that they should be given time to answer that without the state spending $250,000. I'd rather use that $250,000 to ask those questions of CalSTRS, CalPERS, the UC system, and Caltrans, who have been dodging answering those questions all along. I mean, we saw CalPERS and CalSTRS take an enormous hit, and yet their top executives received $360,000 bonuses, and yet we're not auditing them at this point. So I just want to make sure that we're spending that $250,000 on somebody that isn't working with us as opposed to somebody who's trying to work with us. And it may be that this is a dog and pony show that they've rolled out to get sympathy, and if that's the case, I'm with you in 120 days. But right now, I can't get there. So thank you, and I appreciate where you're going.
But thank you, Senator. But I doubt that a few minutes that we've been here demonstrates
Mr. Alejo, can you address those in your close? I'm just
I'll do that.
just trying to move. Senor Norby, go ahead.
Yes, VMH is a public entity, right? And so I presume the board of directors are elected at large by district, or they're appointed by a JPA arrangement.
Large.
So they are elected. How many are there again?
5.
Okay. The vote on the compensation, was that all done under personnel, or was it discussed openly and voted on in a roll call vote?
We don't know yet. That's one of the questions
All
that
right.
we're going to be looking into.
It's an important question. I've been on boards like this myself, some appointed, some not. And I know there's a tendency, especially in closed session, to exaggerate the amount of money that someone needs or that you need to qualify. Oftentimes there's a headhunter involved who is exaggerating that as well because that justifies his fee. And there tends to be a syndrome where the board members almost identify and glorify in the amount they're paying someone because it makes the organization itself look all that much more important. And that tends to be exaggerated when this is all done under personnel. And I know that boards vary on this. I was on a sanitation district board, and we discussed the whole thing in personnel session. I said, look, well, this has to be voted on in a roll call vote in public and discussed, right, rather than just reported out. And that's something I'd be very curious about. I can support it. I think that there are a lot of questions that could be asked, maybe cursorily right now, but I can support going ahead with it. But I'd like to see those questions asked. I think this does send a message to similar boards throughout the state about this, that engage in this kind of, I wouldn't say it's a practice, it's more of a mentality. And we've seen that in other cities, too. Thank you.
Thank you, Mr. Norby. Is there any other questions from the committee? There's a move, and then is there a second? Second by Senator Rubio. Mr. Alejo, I also just wanted to mention that, I'm really making an exception here, given that, I share Ms. Huber's comments about utilizing state resources to really look into one single district issue. I just want to make sure I send that message loud and clearly to other members that this is an extraordinary situation, and I want to use our resources to really focus on statewide issues. But given the issue at hand and my experience and issues in my own district with this issue, I will be supporting your request today. But know that this is an exception. This is not going to be the rule in this committee, and so I just wanted to make sure we pointed that out to you. So there's a motion and a second.
If I could close.
Oh, I'm sorry. Go ahead.
Yeah, well, first of all, I want to say thank you, Mr. Chairman. And yeah, I would agree. This is an extraordinary situation here at this hospital. It made national news headlines for a reason. And I'm glad that we come and get some clarity from the hospital officials saying that they are open to this audit. Because certainly we're hearing something else these last few days here in this very building. And there should be nothing to hide. This is our state auditor is very highly respected. Here she has a great reputation. She's neutral. She'll be able to give us and the public an independent, neutral look about what is happening in the hospital. And it's hard for me, though, to sit here and continue to hear the hospital justify these exorbitant benefits. Our local news media compared Salinas Valley Memorial with the nearby hospital in Fremont. CEO left after many years of service, too, left with a pretty hefty pension of $400,000, not 10 times that amount at $4 million. The salary was $800,000. That's twice what the President of the United States earns for running a country. And here at the Salinas Valley Memorial, earning twice that to run a relatively smaller hospital district. So certainly there's so many questions that need to be answered. And if there's nothing to hide, then that will be demonstrated. And if there's nothing, that will be good news. And if there's things that need to be corrected, our state auditor will report that. But certainly the hospital board can have it both ways by saying they welcome the audit and then hiring their representative lobbyists here, paying them $25,000 to walk the building and saying that they were opposing the audit and then saying something different at this hearing here today. I want to say we need an independent oversight to tell the people of Salinas Valley what exactly is going on in our hospital, and that needs to be reported. And I think the chairman, this request has bipartisan support. I know the Republican caucus has recommended support. I appreciate your support as well, Mr. Chairman. And I ask my fellow members, it's a high priority for me and the people of Salinas Valley, and I ask for your aye vote here today.
Thank you, Mr. Alejo. There's a motion and a second. Secretary, please call the roll.
Lara? Aye. Lara, aye. Alejo? Alejo?
Aye.
Alejo, aye. Grove? Huber?
Aye.
Huber, aye. Monning? Aye. Monning, aye. Norby? Smythe? Alquist? Anderson? No. Anderson, no. De Leon? Dutton? LaMalfa? LaMalfa, no. Rubio? Aye. Rubio, aye. Wolk? Aye. Wolk, aye. That's on call.
This item's on call. Assembly will keep it open. Next, we're going to have Assemblymember Monning, Chair, temporarily, while I present my item.
Takes photos of your presentation, too.
Okay, members, this is tab B, file item 111, presented by Chair Lara. The floor is yours, Mr. Chair.
Thank you, Mr. Chair and members. I am requesting an audit of the California workforce development infrastructure. Specifically, I would like the auditor to review the federal funds received by the state from the Federal Workforce Investment Act. This audit will focus on 3 state agencies and how they are utilizing these funds. At a time when unemployment rates are at a record high and the state is facing a severe budget deficit, we must maximize resources to provide Californians with the education, skills, and support for success in a challenging labor market. Currently, there is not a clear understanding of the integration and the cooperation among all agencies that receive WIA funds. This request is a key step in developing a comprehensive strategy to strengthen workforce training in California. By reviewing the state agencies that receive the most federal funds, we will be able to determine how this money is being used and identify any deficiencies that need to be addressed.
Thank you, Mr. Lara. We will go to the state auditor. Before that, I don't know if everyone heard a motion was made by Member Anderson. Is there a second? We have a motion and a second. Thank you. And now we'll go to the state auditor.
Up and now he just,
Right.
all right. Well, We'll be talking to you later, Senator Rubio. Oh, yeah, sure. Okay, I'll quickly go through this. I know members are very busy. First objective would be looking at the role of the Workforce Investment Board and what their oversight responsibilities are for administering WIA funds, determine how they ensure that the WIA funds are administered effectively. Certainly looking at state oversight, EDD has a very important role in the WIA program and working with the federal government and making sure that those funds are passed through to the local entities. We've been asked to look at, review and assess whether or not the state of California, EDD or other entities has established performance measures to evaluate the administration of WIA funds. Are any of those requirements or performance measures in excess of what the federal government requires? Are we requiring our performance measures perhaps going beyond what the federal government is asking for? A key question is looking at whether or not there are common goals or common measures that are being used to evaluate program performance, particularly at EDD and certainly at the other two state entities that we've been asked to look at. They haven't been specified yet. We'll make that determination based on the other entities that are involved in this particular program. There are a variety of objectives they're asking us to do when we visit both EDD and these other two state entities. And the specific questions that we're being asked to answer is identifying the amount of WIA funds that each of these entities receive for workforce development activities, how much oversight both EDD and these other two entities, again, provide with regard to WIA funds that they administer. What types of programs are these funds being used for, and what types of services are being provided by each of the entities? Looking at the populations for each of the programs and the number of participants that have been served. We've been asked to look at a 3-year window, so we'll be looking at the last 3 fiscal years with regard to populations for each program and the participants in each of those programs. Another question is determining how the entities actually evaluate these programs and the services that are provided. Are they meeting the needs of the participants, both their educational needs, training needs, and certainly the opportunity to gain employment in California? Another area is determining whether they have performance measures and outcome indicators, and are these indicators tracking labor market success? So individuals who go through these programs, how successful are they in gaining and maintaining employment in California? And the last 2 objectives with regard to this portion of the audit is looking at identifying policies and practices used to ensure that the quality and the outcomes for both the worker participants and the businesses that participate in these programs, whether or not those policies and procedures are ensuring quality services. And then the final aspect of this section is determining how each entity ensures that the resources are allocated effectively so that we get the best benefit for these dollars that are being provided to the variety of programs and providing services. And then the final question that Assemblymember Lara is asking us to look at is determining whether agencies are really maximizing the amount of federal money that California is receiving, and have there been any instances in the last few years where the state may not have, we've missed the opportunity to receive additional federal funding. That's the last objective. The budget for the audit's about 2,400 hours. That's about a 6-month project.
Thank you, Ms. Auditor. Witnesses in support?
Good morning, Mr. Chair, esteemed members of this committee. My name is Dennis Petrie. I'm the Deputy Director of the Employment Development Department. I oversee the Workforce Services branch that has administrative oversight for the Workforce Investment Act, more specifically the Department of Labor-sponsored workforce investment funding streams. The Employment Development Department concurs with the contentions of the chair in his presentation and the reasons for asking for this particular audit. We welcome the opportunity to work with the state auditor to uncover these issues and bring forth appropriate data-driven information so that policymakers can make appropriate data-driven decisions. If I was to be so bold, I would only recommend and go so far as to remind the stakeholders and the members of this particular committee that the Workforce Investment Act contains 5 titles, 4 of which provide funding streams into the state of California. Title 1B and Wagner Pizer seem to be the main focus of this particular audit. I think that if I could make a recommendation for the consideration, you need to look at the Department of Rehabilitation and the California Department of Education, who receives two funding streams that are involved in the Workforce Investment Act. The VOC Rehab title of the Workforce Investment Act is received and flows through the Department of Rehabilitation, and adult literacy, the adult literacy title of the Workforce Investment Act is received and flows through the California Department of Education. The Employment Development Department, in concert with the State Workforce Investment Board and the California Workforce Association volunteer members, have been leading an integration effort in the state of California since 2008, and we believe that this particular exercise is very worthwhile and will bring forth valuable policy information. Thank you.
Thank you very much. Other witnesses in support are perhaps here on standby. Would ask you to keep comments brief. We're trying to keep members here who have to get to other committees. We do have a motion and a second on the floor, so brief comments, please.
Sure. Thank you, Mr. Chair, members of the committee. Mitch Seaman with the California Labor Federation here, also in support of the audit. We just wanted to make the point that while there is a minor upfront investment along with this, that we feel through the information gathered by this audit and the way that it could lead to better integration of this federal money through the state and local bodies that we're dealing with here in this audit, that this could wind up saving us a lot of money in the long run and could also leave us with a workforce investment system that gives us much greater bang for the buck in terms of training workers and making sure that they're placed in stable living wage employment. And urge your support.
Thank you. Other witnesses in support? Any public comment in support? Are there any witnesses in opposition? Seeing none, committee members, questions, comments? Seeing none, Mr. Lara, would you like to close?
I just respectfully ask for your vote.
Thank you. We have a motion and a second. Ask the clerk to call the roll.
Lara?
Aye.
Lara, aye. Alejo? Alejo, aye. Grove? Grove, aye. Huber? Huber, aye. Monning?
Aye.
Monning, aye. Norby? Smythe? Alquist? Anderson? Anderson, aye. DeLeon? Dutton? LaMalfa? LaMalfa, aye. Rubio? Rubio, aye. Wolk? Wolk, aye.
That bill is out, and as the chair makes his way back up to the dais, members, there are a number of bills on call, so if you've missed any votes, please stick around, and if other members are listening, please get down for final votes. And I just want to thank the state auditor and her staff for your continued great work. Thank you. Mr. Chair.
Thank you, Mr. Morning. We are going to move to...
Mr. Chairman, a quick question.
Go ahead.
If you don't mind. There was an audit that I was tracking here that wasn't on the schedule today, I guess. Did that pull back? It was by Dr. Halderman. What was the status of that? It had to do with Placer County.
Yeah, that's not on our calendar for today. It was. I think it was pulled. Yeah, it was pulled by.
Do we know why on that one, or?
Yeah, I don't think we're at liberty to talk about that right now, but
okay.
We'll.
Okay. Thank you, sir.
No problem. We are, as we get members to come to committee. What? Okay, you know what? Why don't we lift some calls first before we do the work in progress?
Oh, okay. I forgot.
Go ahead. We are going to lift the call on item 110 by Mr. Norby. Please call the absent members.
Grove? Grove, aye. Huber?
Aye.
Huber, aye. Smythe? Alquist? DeLeon? Dutton? Rubio? Rubio, aye. Wolk? Wolk, aye. That's out.
That item is out. We are going to move to item 113. Secretary, please call the absent members.
Grove? Aye. Grove, aye. Norby? Smythe? Alquist? DeLeon? Dutton? That's still on call.
That item is still on call. Moving to item number 115. Secretary, please call the absent members.
Smythe? Alquist? DeLeon? Dutton? Rubio? No. Rubio, no. Wolk? No. Wolk, no.
we'll leave that item on call. Anything else? Okay, that, apologize, we're going to do item 117. Secretary, please call the absent members.
Grove. Grove, aye. Huber. Huber, aye. Smythe. Alquist. DeLeon. Dutton. LaMalfa. Rubio. Rubio, aye. Wolk. Wolk, aye. That's still on call.
That item is still on call. We are going to move to the work in progress. Senator, go ahead. The floor is yours.
Senator, wow.
Oh.
Outstanding.
It's been a day.
No, just I'll make it very
State
quick.
auditor, please.
Very quick. We currently have 16 audits in progress. Most of those audits were audits that were approved by the Joint Legislative Audit Committee. 11 of those, 5 statutory audits. We didn't have any audits waiting for staff. As the committee already considered, there were 6 audits up for consideration. We had the ability to start 2 audits this month, 3 next month, and 3 in July. So to the extent the committee decides to make any of the audits priority, we can start 2 this month.
Great. Thank you. That was a very concise report, State Auditor. And we are going to leave the roll open for 10 minutes. So if members can please mosey on down and cast their votes on the pending items, I would appreciate it. Thank you.